Lesson number 2, patient responsibilities and health insurance. Hi, it's Mike. How are you doing today? Thanks for coming. If you remember our first lesson, we spoke about patient responsibilities with health insurance plans. In this lesson, we'll discuss patient responsibilities in a little more detail. In order to understand this lesson, there are a few health insurance terms that you'll need to know. The first term is called cost sharing. This means that this is the amount that you will be contributing to the cost of your health care. The insurer pays their share of your care, and you pay your share. Every time a claim is processed and paid, there are two parts. There's the insurer's part and the patient's part. The patient's part is also known as the patient's responsibility. Always, when you receive your explanation of benefits statement from your insurance plan, always review the insurer's part as well as the patient's part. You'll see it'll make your health care a much more understandable and easier to go through experience, to be sure. The next term is copayment or copay. A copay is just a flat fee paid on the date of service. That's all it is. Very simple. Copays can apply to a wide range of medical services. Your deductible is the amount of money you must pay before your insurance plan starts to issue payments. For example, if your deductible is $5,000, you must pay $5,000 before your insurance plan starts to pay anything. The $5,000 is calculated by the insurance company by the approved amounts for each claim that is submitted by your provider. When the approved amounts reach $5,000, because of course the claims won't be paid, but when the approved amounts reach $5,000, then you met your deductible. And then they'll start paying at whatever rate they pay at, minus the copay, of course, and minus the coinsurance. Chances are you'll still be paying through other cost-sharing mechanisms like copays or coinsurances. So just because you've met your deductible, be sure to understand that the insurance company will not be paying for everything. Chances are. But there's an exception to this, and that's called regular Medicare. Regular Medicare, the way they do the calculations is different than the way commercial insurers do it. They calculate the deductible into each claim along with the coinsurance until the deductible is exhausted for that year. That's what makes Medicare different than, other commercial plans. If you have regular Medicare, please be advised to look at your explanation of benefits from regular Medicare and to see how they do this. It's a very simple process, and the EOBs explain it in pretty good detail. The next term is coinsurance. This means that there is a certain percentage of the claim's approved amount that you must cover, with your insurance company picking up the rest. For example, Dr. Smith charges you $150 for an office visit. He then submits that $150 claim to the insurance company. The insurance company, assume that this is an in-network claim under assignment, has an approved amount. That's the amount that the insurance company will pay for the procedure. In this case, it will be $80. If your coinsurance is 20%, you will pay Dr. Smith $16, which would be 20% of the $80. The insurance company will pay Dr. Smith $64, which is 80% of the $80. The last term of this lesson will be called the out-of-pocket maximum. Many people have difficulty with this concept, but actually it's really simple. This is a cap placed on your plan that limits the amount you will pay in a year to a certain level. For example, many of the Affordable Care Act marketplace plans have an out-of-pocket max of $6,600 for an individual and $13,200 for a family. Once that person pays $6,600 in deductibles, co-payments, and co-insurances combined, the insurance plan will then pay 100% of your in-network costs. Please be advised, that's in-network cost only. Now I'll repeat that. That's in-network cost only. Out-of-network claims have to go through the balance billing process, the cycle we spoke about in Lesson 1. Please be advised. I wanted to make this lesson as short as possible to make it easier to understand. In our next lesson, we will look at how cost-sharing mechanisms work on a wider scale. On that note, that concludes our lesson for today. If you've enjoyed what you've heard today, please subscribe, like, and comment. Thank you for your time, and take care.